This is a CBS 4 News special report.
Governor Ron DeSantis is holding a news conference in Jacksonville. Let's listen in.
I also want to thank the city of Jacksonville for all that they've done with this test site and everything else they've done to protect their community. I want to thank the mayor, I want to thank the sheriff, I want to thank other folks. This test site was one of the sites we requested that the federal government help support because we thought expanding testing was something that was very important in the state of Florida. If you look right now, we have now done over 160,000 tests completed, and you have thousands and thousands of more where the results will be coming in over the next few days. So I think by next week, we will probably hit 200,000 tests at some point. That is a good thing to expand testing. We're now testing, I think about one in every 140 Floridians has been tested. South Korea had been the kind of testing model, and they had done one every 200 in South Korea. So we've been able to ramp this up in a relatively short amount of time, but we want to keep doing it. So this site has already done thousands of tests for the people of Northeast Florida, and I think that that's been something that's been very good. The federal government sourced this and provided us PPE and some of the testing swabs, so we appreciate that, but this was only supposed to go to April 10th. And then the feds were going to either turn it over to us or let it go. But I thought that it was important to keep it going. I spoke with the mayor. We want to be able to have access to testing across the state of Florida. And so we made it clear we're going to be here. We're sending support from the state of Florida. We got additional National Guard coming to be able to make sure that the people have access to a drive-through testing site. And then once we put our commitment out publicly, FEMA actually said that they can continue to also send some supplies to help out. So I think that that's been a win-win, and we want to continue to do it. So for all three sites throughout the state of Florida, Jacksonville, Orange County Convention Center in Central Florida, and Hard Rock Stadium in Miami-Dade County, all three of those sites are going to continue going forward. And I think it's important in all of those communities that we're doing that. But the one thing that we're going to do differently, and I think even better, is we are going to expand the criteria for those who are able to come through these testing sites. When we started it, the federal contracts limited the amount of samples that could be taken daily to 250. Now, they did a good job here in Jacksonville getting people through. That probably was pretty consistent with demand. I think Orlando, Miami probably had some more demand than that. And so now that the state is taking over the testing, we are going to open it up. We want to do more than 250 a day if the demand is there. But because it was limited, you were focusing on 65 and plus with symptoms, as well as first responders and healthcare workers. And obviously, that's the tip of the spear, the people that are out there protecting us. And then those folks who are 65 and plus, they obviously are most at risk from this virus. So it made sense to do that. But I think, though, we really want to expand that beyond. I think we have the capacity to do it, and I think that that will give more opportunities for people in Northeast Florida and other parts of Florida. So starting this Monday at the site here in Jacksonville, at the Orange County Convention Center, and at the Hard Rock Stadium in Miami-Dade, anybody that has coronavirus symptoms, regardless of age, can come and get tested. All first responders and healthcare workers can get tested. And then anybody who has had close sustained contacts with an individual that has recently tested positive for COVID-19 may get tested, even if you personally haven't developed symptoms. I think what we're trying to do is get a sense of people that are asymptomatic, who may be carrying the virus and may be spreading the virus. So if you've had close sustained contact with somebody, even if you haven't developed symptoms, if that person you've had close contacts with has tested positive for COVID-19 and you want to come get tested, then you're going to be able to come in these sites. And I think that this is important. Healthcare workers includes any staff member at long-term care facilities. We've done things very early on strict rules, strict limitations on access to these facilities where some of our vulnerable residents are. We've required all people who work with residents to wear PPE like N95 masks, and we want to have those workers to be able to have the ability to get tested as well. So if you work at a hospital, obviously you qualify, but if you work at a nursing home or a long-term care facility, you qualify as well. So we have now, as I mentioned, tested about 163,000 with test results. We've tested more, and those results come in on a rolling basis. We have a total of 6 drive-through sites in addition to the one here in Jacksonville in partnership with the Florida National Guard. So we've had tens of thousands of people be able to come through these sites. We're also doing our best to expand access to rapid tests. These will be a game changer. There's a couple different tests. There's a 45-minute test by a company called Cepheid, and that has been distributed to certain hospitals throughout the state of Florida. And then we have the Abbott Labs 5-minute test that has just come on the market. We were able to get that sent to a lot of hospitals. Here in Jacksonville, they sent it to St. Vincent's, but we're looking to get that available to all hospitals throughout the state of Florida. So some of that is some of the ones that the state has acquired at the Department of Health. We're going to be sending those to different places throughout the state of Florida, but we're also asking some of the hospitals that have a lot of these machines, if you have another hospital system in your demographic, in your DMA, maybe send them a couple so that everyone has access to this, because this really helps healthcare workers. It really helps identify patients as they come in with symptoms, whether they're positive for COVID-19 or not. We're also trying to acquire the new antibody test. There's a lot of these tests out there, but it's important. You got to get the test that's FDA approved for this particular coronavirus. This isn't the only coronavirus that circulates. So some of these tests will determine whether you have antibodies for any coronavirus. Well, if you had a common cold or something, that's much different than this. So we're looking at tests that are FDA approved specifically for COVID-19 antibodies, and then be able to do that. That will be helpful in a couple ways. One, it'll give us a sense of how much this virus has actually penetrated the community. You have people that are studying this at places like Oxford and Stanford, and a lot of people think that this may have been way more prevalent than we thought. It just, a lot of people don't develop symptoms from it. So that having an antibody test and doing some sampling will give us an idea of how much it's penetrated. It will also give us a more accurate denominator. You know, we test people, and then if they're positive, we say that's a case, but there are probably a lot of people who've never even sought medical care who may have had this virus because they just didn't develop severe symptoms, or maybe they didn't develop symptoms at all. So that's very important. It's also important if you know that you have the antibodies. I think the general thought is that you've developed some sort of immunity to being infected in the future. They're not 100% sure on that, but I think that's kind of the general consensus on that. So I think having wide antibody testing will be something that's very, very important in Florida, and we're working as hard as we can to roll that out. Another update on travel. As you know, when people come to Florida from the hot spots, either by plane or by car, they are being met at the border, met at the airport, and they have to self-isolate for 14 days. So we have screened about 17,000 people from either New York City or New Orleans over the last, I guess we're probably looking at a week and a half now. So we want to continue doing that. We also have put out huge amounts of supplies. As of yesterday, the Division of Emergency Management has sent out 5.2 million masks, more than 500,000 face shields, 4.75 million gloves, and 275,000 gowns. So this has probably been the biggest logistical operation in the history of the state of Florida. I was talking to the White House. We're anticipating getting more of the N95 masks as well. So we'll push even more masks out, hopefully, over a very short period of time. The PPE is very important for the healthcare workers, and it's been a big priority for us here in the state of Florida. If you look at hospitalizations, The whole premise of flattening the curve was you needed the healthcare system to be able to cope with the infections and people that needed to be hospitalized. So that's something that we've taken very seriously in Florida, both in terms of the social distancing, but also doing things like stopping the elective surgeries to make sure we have room in the hospitals. Right now, the capacity in Florida hospitals statewide, 44% of the hospital beds in the state of Florida are available. Statewide, almost 40% of ICU beds are available. Here in Duval County, you got about 45% of the beds are available, and almost 48% of the ICU beds are available. And so we track the hospitalizations very closely to see what trends are developing. Over the last 8 hours, there's been a net reduction in 50 people hospitalized for COVID-19, net reduction of 2 in Duval County, but that is really a good indication of how this is trending, so we keep an eye on that. We also, though, even though there is capacity, we've planned from the beginning if there were to be a surge situation. So we have facilities in Miami-Dade, Broward, Palm Beach. We have the capacity to have a field hospital here in Jacksonville should the need arise. And then we're also looking at Central Florida and trying to figure out how this develops. But right now there's capacity, so that's a good sign. And we want to hopefully get through this where the hospitals are intact and we don't have any part overflowing. One thing that we've been very insistent on really from the very beginning is protecting nursing homes, long-term care facilities, and assisted living facilities. This is a virus that, if you look in the state of Florida, over 85% of the fatalities are people 65 and up. Usually they have chronic conditions, but clearly this is a virus that I think presents a specific danger to elderly populations. And so we've done things like put strong regulations in place, limit visitation, and require that hospital staff wear personal protective equipment, including masks when they're interacting with the residents. And I think by and large in the state of Florida, the folks who've been in charge of these facilities have worked very hard at protecting their residents. We have had the Department of Health now has a strike team on site at a nursing home in Suwannee County. There was an outbreak there emanating from staff members. So we have 51 people affiliated with this facility that have tested positive. 30 of those are members of the staff. And so this is a situation where, if a staff member is sick, they cannot be allowed to go into that facility. And it seems like most of the interaction was with other staff, but you still have 20 residents that have tested positive. There are more that are waiting results. So that investigation is ongoing by the Department of Health, but they have traced the positive cases back to an employee that is working directly with the residents. Final update I have is regarding the unemployment compensation. So far this week, we have a total of 225,755 initial claims that have been filed. Obviously, those need to be processed. We have the Connect system, where there were some changes to that to increase capacity, but we've also done a PEGA site, so people can apply through that, and then the data is going to need to be migrated through Connect. So they're working on that, but that site is able to take a much higher volume of people coming into the site. We've also have almost 12,000 applications received by paper. Federal Express was kind enough to offer their stores where people could drop off applications, and then they're now mailing them to Tallahassee. We have over 2,000 state employees from various agencies that are either on standby to help this or are actively helping the processing of these applications. We've also beefed up the call center, and I've told them you need to beef it up as much as you can to be able to meet the demand. You're seeing this throughout the country, but the amount of unemployment claims nationwide in just a few-week period, I think it took us a year or certainly many months to be able to reach this level of claims during the Great Recession. So this is a shock like we've never seen before. So we're shifting as many resources to this as we can to be able to meet this real crushing demand. So I want to thank the mayor, the sheriff, Jacksonville Fire Rescue, everybody who's been involved in this site. I think it's important that we keep it going, and I think it's important that we're going to have expanded test criteria so a greater variety of people can come in. Anyone with corona symptoms, anybody who's got works at a healthcare facility or is a first responder, and then even if you haven't developed symptoms, but you've had close sustained contact with somebody who has recently tested positive and you want to come and get tested, we are testing those people as well. And I think that that's a good approach, and I think this continues our efforts to make testing widespread in the state of Florida.